Live. Hello. It's Huang. Oh, I am live on Instagram. Hello, everybody on Instagram. I am live on Facebook and on YouTube. Hello, world. Hello, hand therapy world. It's Huang here. I'm an occupational therapist and certified hand therapist, and I thought I'd come on today and talk about how to improve, how to increase your skills and become more marketable. So, I just recently came back from the hand therapy conference. If this is the first time that you're on, my name is Huang. I'm an occupational therapist and certified hand therapist. Hello, I see a couple people coming on. Whether you're watching this live or you're watching this on replay, please feel free to say hello, give me your name, tell me a little bit about yourself. Uh, if you're trying to get into the world of hand therapy or if you're already working in it, um, it's a great place to be. So I was just in DC for the hand therapy conference, and what can I tell you? It was a lot of fun. It was a lot of fun to be in a different place, and every time I go to a conference, it's for different purposes, But a lot of the times, at the end of the day, when you're looking to go to different conferences or different classes, so many things about it, it's really, I mean, what's the whole point of doing it, right? I hope that is more than just for CEUs. I hope that it's to in some form or fashion improve your skills, right? Improve your skills, because I always say this: if you improve your skills, there's a lot. Not only do you feel really good about helping the patients that you work with, but really the whole point is to become more marketable. Like, I don't know about you, but I have spent a lot of time and a lot of money and a lot of effort into becoming an occupational therapist, and I can't imagine having to go back to do something else, to get another degree. I mean, like, I really don't. So if you're here and you're watching, um, especially Hand Therapy Secrets, if you're watching Hand Therapy Secrets, I would imagine that you're an occupational therapist looking to grow yourself in the world of hand therapy. Let me know. Yeah. Hey, Missy from Washington, still sticking with it. Yay, Missy. Yes. And everyone's got their own journey. Like, really, honestly, everyone's got their own journey when it comes to working in hands and, even in occupational therapy. I've been talking to a lot of different people, and really everyone does. Sometimes I've been talking to people who OT is their second career, but once they chose it as their second career, they knew that they wanted to do hands, or it was an area of, high interest. I speak to people who have been working in OT for many years, let's say 10, 15, 20 years, even, 40 years, who now want to become, more in the realm of hand therapy. And let's face it, in this day and age where your patients are going to YouTube, I have one of my patients, he's like, I go to YouTube, and he looks things up on YouTube, and then if he can't solve his own problems on YouTube, then he comes in. Now, mind you, this guy's been coming to me for several years for various different types of injuries. Like, he'll come in, and he'll tell me about all the YouTube videos he watches, and then he's like, yeah, but it's so hard. So then he comes in, So imagine, even if not all your patients are doing it, like, I have tons of people get injured and they never think to look on YouTube. Uh, but, more and more nowadays, let's face it, we have to be realistic about the fact that the people that we are working with are going to YouTube, they are getting therapy, um, free, between social media platforms, YouTube, even TikTok. The number of people who tell me how much they learn from TikTok, it's really incredible, right? And if you're a creator, like, by all means, it's wonderful to share. I share a lot um on YouTube, on Instagram, but if we're sharing and other people are sharing, like imagine how many free things are out there. So even with all the free shares, you have to think about, how do you as an occupational therapist stand out? How do you stand out amongst the crowd? How do you stand out uh, to really, at the end of the day, to keep helping your patients, right? We have to keep helping our patients the best way. We want to be able to work in a very particular setting, right? Let's face it, most hand therapists work in outpatient, or have the opportunity to work in outpatient, or just even as an occupational therapist, having the opportunity to pick and choose where you want to work in outpatient. Which type of setting do you want to work? Having the choices, because you are skilled, having the confidence to say, I want more money because of X, right? I mean, everybody, I think everybody wants it. Nobody wants to say it out loud, but you should say, yeah, I want to get paid more for the value that I provide, right? So you can essentially get job security two ways, right? You can get job securities two ways. And really, it's about, if you increase your skills and you become more marketable. You increase your skills and become more marketable. That's how you have those choices. That's how you have more choices and dictate, where do you want to work? How do you want to work? What's your pay rate? But it's not just increasing your skills. It's about increasing it in a very particular way, which is through problem solving, right? Your patients come to you because you can solve a problem for them, right? People come to me because I can solve a problem for them. Um, and then the other way, outside of you increase your skills, how do you make yourself more marketable, right? How do you make yourself more marketable? And the way you make yourself more marketable is by specializing. It really is. It's about specializing, um, and doing a job that not everyone can do, right? And one of those ways is to become a certified hand therapist. Like, let's face it, there's a reason why there's not that many certified hand therapists, right? And there's a slew of certified hand therapists retiring. And you have an opportunity, if you are up and coming, starting out, been in the world for a while. I mean, if you think, I'm in my 40s right now, I've been a therapist for over 20 years. Dude, I got 20 more years and then some in me. So, I don't care when people tell me, oh my God, I have like 20 years of experience, 24. Who the fuck cares? Do it. Become a certified hand therapist. Because at the end of the day, first and foremost, you'll help your patients, right? We as therapists feel great when we help our patients. We feel great when we get results for the people who come to us for help. Like, hands down, number one. Number two, is the respect, right? Let's be honest. I think that the more and more I speak to OTs, they want to help. They want to help they want to help the patients that come to them in a way that gives them like fulfillment, like seeing the results of their work, being able to help someone get out of pain, get more motion, avoid surgery, have the best possible outcomes after surgery, like all the good stuff, right? But more so, I think, or just as much, just as important, is the idea of, getting the respect that you deserve for the work that you do. And the way I see it is, respect is earned and not given, right? Respect is earned and not given. So how do we earn that respect? It does come down to skills, being able to understand, or being able to explain why something is happening the way it's happening, and then creating or doing the treatment, providing the treatment that actually gives you the end results, right? So when it comes down to hand surgery, like this is often what I talk about a lot when I speak to people studying for the exam, right? The cohort currently right now is they're about to take their exam. And if you're watching this and you're about to take your exam, this is the key thing, right? It's about applied knowledge. It's not just about memorizing, it's about how you use the knowledge that you've learned. When you have a surgical case, you essentially know what the problem is, right? If you have a surgical case, I have a tendon laceration, I repaired it. You know what it is. But now here's the thing that you have to be able, here's a skill, is being able to problem solve through it and identify not just where it is. That's relatively easy if you look at the scar and stuff like that. You have to know what are the potential problems that are going to come. That comes with knowing what the protocol is to be able to take someone down a certain path of progression. And then once you know how to do that, you also are providing a particular type of treatment for them, right? When do you go into extension? When do you go into flexion? What kind of splints you use? What modalities you use? And when it comes to the exam, it is not about just what you would do. It's about what you can do, not what you do right now, right? There's a lot of different techniques, and really it comes down to that. Thinking about what could you do, not just what do you do. Now, you have your surgical cases and then you have your non-surgical cases. And just being able to critically think through your non-surgical cases really comes down to knowing how to evaluate that person to say, I know you might have symptoms here, right? You might have pain symptoms in your hand, but could the problem be at a hand level, or is it an elbow level, or is it a shoulder level? Could it be a nerve problem, right? So when you increase your skills, you're not just memorizing and increasing, oh, how do I touch someone? How do I mobilize someone? How do I use tools to, to move tissue? The skills that are required come from the fact that you're able to critically think through, okay, anatomy, knowing the types of injuries or how tissue heals or how tissue gets damaged, so that you can problem solve and say, this is actually a problem of a nerve impingement, or this is a problem of a nerve entrapment, right? Versus a tendonitis, which is a muscle tendon type of problem. That's the critical thing. That's the skill I'm talking about. Like, man, you hone in on that, boom, you can help just about anybody. And then you're able to express it, explain it to your patients, get buy-in from them that you know what it's going on with them, so that you have an opportunity. They'll come back to you time and time again in order to fix the problem that they have, right? As you get ready for that, studying to become a certified hand therapist now becomes key. If you are working 50% in hands, right, or want to work in hands forever, becoming a CHT not only increases that critical thinking skill that I'm talking about, but you increase it automatically when you prepare for the exam. When you prepare for the exam. And also, it just makes you more marketable. Can you imagine? You don't have to know how to do everything, but you do need to know how to critically think through if that type of case comes your way. One thing that I've always said is I've never had a toe to thumb transfer, but if I did, I would know exactly what to do. I would know what to do with a toe to thumb transfer, because I know how to critically think through that, depending on their stage, right? Depending on their stage. Well, first of all, I understand that the thumb does 50% of the work of my hand. My thumb has a lot of motion, has a lot of circumferential motion, very similar to my shoulder, right? It is the motion, it is the part of my hand that allows me to have functional grip, for strength, to have fine motor pinch. Without my thumb, I lose a lot of function. I lose fine motor function, I lose gross motor function, right? So just understanding that much helps me to understand like how important a thumb really is. So when your patients come and they're like, my thumb hurts, like, yeah, it's very debilitating. It's very debilitating. So how do you work with something you have never seen before? Well, I know how bones work. I know how the thumb is supposed to work. I know all the muscles that make up the intricacies of the hand. So you have your extrinsic muscles, the ones that start outside and go inside, what its function is. And then I understand that, intrinsic muscles and what those are supposed to, do for me. But because I understand what normally happens with a thumb, I know what happens abnormally too. And if I have a toe, place in there, what am I really looking for? I'm looking for a particular type of movement, enough movement, fine motor coordination, a certain amount of strength functionally, right? Actually, I'm working with a really severe brachial plexus laceration. And one of the things I always talk about, I mean, I've seen a good number of brachial plexus injuries, and I can tell you right now that no brachial plexus injury is the same. I've had stretch, I've had compression, I've had, above the or collarbone, above the clavicle types of brachial plexus. I've had below, I've had vascular. This is the first time that I've had it as a medial cord laceration and repair. And when you get an injury like that, age plays a role. Age, what they're able to do, how committed are they? It really gives you an ability to see, what is potential, what they could gain. And man, this guy's done incredible. Because every single time I chuck things at him, I'm like, well, we have to work on 1, 2, and 3 first. When he came in really severe, these are the things that I need. I need passive range of motion. I really do. And you know why? Because without the passive range of motion, without us being able to make sure that his joints stay supple, his joints stay, mobile and movable, then how would we ever see what comes back, right? Number one. Number two is we have to do certain things to help protect the joints, right? Position the joints. And so that requires a certain amount of splinting, right? So all that, just because I've seen them before, doesn't mean I've seen his particular case before, but I can critically think through it. And I think what's helped me be able to, what's helped me be able to work with so many different types of injuries is the ability to critically think through, and this is essentially how I teach. Because all of our experiences are so different. Like I can talk to someone, I'm helping someone, and their, majority of their cases might be traumatic, right? They might work in a trauma hospital, they might work with trauma hand surgeons. So all they see is trauma. And because of that, they get very particular types of cases and they don't get other ones. Other people I work with, they get a lot of like the geriatric, the mixed, maybe they see a lot of shoulders and elbows, but maybe they don't have a chance to see a ton of tendons or a ton of nerve lacerations. So everyone's journey in hand therapy is different, but what is the same is how you could learn the concepts, right? And I'm a big believer in understanding concepts, like learning through understanding of the concepts, and then as you're studying, having a cadence of study. Meaning that there are times of spike in how you're studying, how much you're studying, and how much you're absorbing. And then there's like a little bit of a downhill to rest. And then there's got to be a spike before. And this is one of the reasons why, the program that I've developed is the way it is, so that you can have that cadence, right? So one, the method that I really like, that I use, that I teach, that is a part of the exam prep program, is really understanding concepts, just like those two examples that I talked about, because everyone's experience is so different. If you understand concepts, you don't have to sit there and memorize everything. You really don't. And the other thing is, when you understand concepts, man, they make memorizing that much easier for you. Right. So this is why I teach the concept, and then the cadence of studying. The cadence of studying really can help you so that you don't get so burnt out, so that you don't feel so overwhelmed with the amount of information. So some people are now, as they're getting closer and closer to the exam, there's a sensation of being burnt out. And I would almost say that maybe it's not like being burnt out, but that you're just so ready to take the exam already. You know what I mean? Because it's so close. So I'm going to give you an analogy. You let me know if this is true or not. Whether you're watching live or you're watching this on replay, let me know if you think this is true. You know how when you have to pee, come on now, you've been somewhere and you're like, oh my God, I gotta pee so bad, I'm about to pee in my pants. But you're good, you hold it in, you got no problems. As soon as you park your car, the idea of you're so close to that bathroom and you're trying to get, out of your car, unlock the door. I mean, come on. Like, the sense of urgency is even worse, right? Even worse. So that's kind of like getting so close to the exam right now. Some people are just, they're so close, they can taste it, right? And it's just about hanging on just a few more weeks, just a few more days. And instead of saying like, can I do this? Asking yourself yes, no question. No, flip the switch and say, what needs to happen in order for me to get to my exam date? Right? And we can say that, we can ask that question all along the way. So whether you're just about to take the exam right now, or you've got 6 months, right? So right now the exam prep is open. I'm winding down this current cohort. They're about to take the exam. So there's some people in there that have been with me for a little while and they're about to take the exam. And then there's some people in the cohort that just knew that they needed a longer time frame with me. So they've been in for a few months, but they're going to go until the May of 2023 exam. But that's essentially the method. It's just learning through concepts, and then to the cadence of the study, and then just putting consistent effort towards studying when you're in a mentorship program, when you're in a group or a community where you're getting that one-on-one, where you're getting that constant, like, personalized help of, whether it be email or the private Facebook group we have, or the live calls that we're on. Just being able to have someone who you can reach out to that's completely independent. And I think that's been, a really game changer for a lot of the people who have been through my program, of just having that, like, consistent person that they could rely on to give them a straightforward answer, right? No judgment, private as they want, or, just being able to connect with certain people within within their group that can really just help out. Like, some people get on little private study study calls together. Some people do it through our bigger study groups. But it's just a great way of just making sure that you're, one, committed to becoming a certified, and two, making sure that you're putting together consistent effort, right? And that's essentially what is required to become a certified hand therapist, right? It's not, yes, you have to, you have to have the years, you have to have the hours. And one thing that I've been looking at quite a bit and just comparing on who does really well over time is their where they're working, their type of caseloads, the type of patients they see, because it really helps to say like where could you put your focus that's going to really help make the biggest difference. Like you can take years and years to study, but one of the things I'm trying to do with my programs, I'm trying to help people take less time to study, right? Because if you can get it done in a fraction of a time, you won't get so burnt out. You'll be able to do it easier. You will be able to do it um, with less work, with less, overwhelm, with less reading, right? So just keep that in mind. If you want to increase your skills, if you want to become more marketable in the place, like right now, it's just, it's a little bit harder. People are looking for, very particular skills. They've always been looking for very particular skills, but now people don't have time to be messing around, right? They want someone to come in and really be able to help them. Companies want to hire people who know what they're doing, that can come in and be able to provide certain type of quality therapy for their patients. And what that is required is that critical thinking, that being able to I'm able to problem solve through, because I know how to apply what I know. I don't just sit there and I just memorize and know. I know how to apply that information. So skills through critical thinking, problem solving, right? And then two, just specializing. When you specialize and you can say that you're a certified hand therapist, really makes you more marketable. If you're doing a little bit of hands, you can do a lot of hands. If you're like doing, hands in this particular setting, you can then, always make sure you're in an outpatient setting. If you move to another place, another city, another state, you have the opportunity to say like I'm a certified hand therapist, and it'll make it easier for you to move into the positions that where you want to be versus just taking any old job. You look at people in travel therapy. We understand that people are going into travel therapy because one, it pays really well, but two, um, it pays really well. No, but you get to travel the world, right? But listen, let's face it, there are travel positions because they can't find therapists. Now, you can be stuck working in any old little place. You can be stuck working in skilled nursing. You could be stuck working in, I don't know, in a hospital setting. But if you really wanted to make sure that you not only got paid well, but got to travel and got to go into certain places, having your certified hand therapy credentials, specialty, allows you to build that respect and build that trust just from having your credentials alone, uh, versus earning it over a period of time. So that's how I think, if I'm on this path to help more occupational therapists, build their careers, have more choices, make more money, that kind of stuff. Like, dude, specialty is one of those ways. Really, you can take this to any area, being able to problem solve. But man, if you can problem solve and how every person that has a hand or arm problems, whether they have a hand or arm or not, right? They're going to have problems. And you, as an occupational therapist, you can help them increase how they live in their life, increase how they work, how they function, how they play, right? And you can do it through becoming a certified hand therapist, right? There's a lot of OTs right now that qualify. And I think the only thing holding you back is your commitment to studying, the commitment to becoming a certified hand therapist, and then putting forward the continuous effort to study. It's so worth it though. It's so worth it. So if you've been thinking about it and it's something that you've always wanted to do, but you've been putting it off for lots and lots of different reasons that we do not need to go into right now, if you want to, then please, the exam prep program is currently open. I'll share the link for you. It's at handtherapysecrets.com, and you can go there. You can take a look at what that program entails, the cost there, the details, all that good stuff is there. And then you can apply for the program. It's so easy. Just click your name, say, I want to be in this program. And then I'm going to send you a series of questions and just ask you, a few questions just to see like how serious you are and if this is the right time, if this is the right program. There's absolutely no pressure in it whatsoever, but at least give yourself a chance. If it's something you're thinking about, give yourself a chance. Don't just count yourself out, right? Because I know that the cost of committing to it, it is not as expensive as the cost of regret of never having done it or never giving yourself the chance. All right. So anyway, that's my take on how to improve your skills and make yourself more marketable. All right. So if you have any questions, if you're on Instagram, go ahead and slide into my DMs. You can go to the link in the bio and check it out. And if you're on any other platform, you can do essentially exactly the same thing. All right. And I will talk to you guys next time. Thanks so much for joining me. Bye. Bye. Oh, I can't use my fingers. I forget.